Hello, everyone. Good afternoon. We're going to be starting in another minute or two. We're just going to give folks a few minutes to join, and we'll be starting momentarily. So welcome again, everyone. We're going to go ahead and get started. It's a pleasure to see everyone here today in our May CDC's Model Aquatic Health Code Network webinar. This month, we're going to be talking about swimming safe with the latest edition of the Model Aquatic Health Code. As a reminder, this webinar is being recorded, and we will share not only a link to the recording, but also a copy of the slides in a follow-up email to all the registrants. Throughout the webinar, if you have any questions, please use our Q&A box to submit any questions to our speakers. We will probably have plenty of time at the end to go through all your questions today. So again, welcome. And with that, we're going to go over our agenda for today. So we're going to start by sharing a little bit of the trends, the past patterns, and some fast facts about our webinars. For those who are new, we have actually been conducting this webinar since 2016. We have a wealth of resources to all of you, and we're really glad to share with you in a few moments about where you can find the previous recordings and a little bit of the information that we have covered over the years. We'll then pass this presentation to Commander Joe Lako from CDC. Joe, we're going to be talking about the 4th edition of the MAC, the latest changes, and also about Safe Swimming Week. And then we're going to wrap up the presentation with Dewey Case. Dewey is going to be sharing with you how you can submit change requests to the 5th edition of the MAC and how they're moving forward the CMAC with the latest update of the MAC that is coming out. And then, as I mentioned, we're going to have a Q&A at the end. With that, it's my pleasure to pass to my dear colleague, Rebecca Rainey. Rebecca will share more about our MAC webinar trends and much more information to all of you. Thank you.
Great. Thank you, Daisy. So hi, everyone. My name is Rebecca. I am a program analyst at NACCHO. So before we get into our main presenters today, we wanted to talk a little bit about just the history of our MAC webinars, reflect on some trends, and share some resources with you. So like Daisy mentioned, the MAC Network webinar series as put on by NACCHO has been going on since 2016. And in that time, we've had over 35 guest participants, and 8 of those were recurring guest presenters. And you'll see this link here. We just recently uploaded all 32 of the MAC webinars onto a YouTube playlist on NACCHO's official YouTube page. So we will be sending out these slides to attendees if you want to go through and look at any of those videos here. But some of our most popular MAC webinar topics covered the most, receiving a lot of interest, include cryptosporidium in public swimming venues, cyanuric acid, increased risk venues, flotation tanks, indoor air quality, MAC updates, using the MAC in local settings, and Healthy and Safe Swimming Week resources. You can also visit NACCHO's MAC webpage, which is also linked here, for more information and resources. So we have this handy little graph right here showing our attendance to this webinar series since 2016. We're really fortunate to see a growing interest in this webinar series in the MAC and aquatic health. And so with that, I just wanted to say a quick thank you to everyone here today, whether this is your very first ever MAC webinar or you've been here since 2016. It's really great to see this growing community of people who are interested in MAC and aquatic health and learning more about it. So that being said, I'm going to turn it over to our presenters today. So up first, we have Commander Joseph Lako. Commander Lako is an environmental health scientist at the National Center for Environmental Health at the CDC in Atlanta, Georgia. His work focuses largely on recreational water, emergency outbreak and response, food safety, drinking water, wastewater, vector control, safety and PPE, and hazardous materials. And after Commander Lako, we're going to have Dewey Case talk. And Dewey is the technical director of the Council for the Model Aquatic Health Code. He has served in various roles with the YMCA of the US, the local and state chapters of the American Red Cross, on the Lifeguarding and Bather Supervision Technical Committee for the first edition of the MAC, and the Technical Review Committee for the third edition of the MAC, as well as managing various aquatic health facilities over a 24-year span. So, Joe, I'm going to let you take it away.
Thank you very much, Rebecca. So today I'm going to talk, as was mentioned, about the new MAC edition, 4th edition, that was released earlier this year. Next slide, please. And I'm also going to go over a few tools for the MAC that we have online, as well as this year's theme for Healthy and Safe Swimming Week. But before I get started, I want to acknowledge a few folks, in particular, Samaria, Michelle, and Dewey. We all worked very diligently last year for getting the 4th edition out. But in particular, Michelle and Samaria has used this very similar presentation to go on the road and do our road show to promote the 4th edition of the MAC. And they've given a very similar talk. So I wanted to thank them publicly for letting me use their scripts and use their presentations as my template. And of course, Dewey has had a big role in that as well, and has also done a lot of promotion for the 4th edition MAC. Next slide. So last go round, so changes from the 3rd edition to the 4th, we had over 500 change requests that were submitted. It was a very daunting task to go through all of those and take every one of those seriously. And we did that with the helps of our technical support committees and our technical review committee. And Dewey and I were on the technical review committee. I think Michelle was on the technical review committee as well. And we looked at every single one of these, made some decisions on how we felt about that, and presented it to the board of directors and the CMAC membership to vote on those. So some of the ones that were passed and put into the MAC, of which there were over 300, were some technical changes. There was a lot of language consistency updates. For example, sometimes we called something a pool, sometimes we called it a venue. Sometimes we called something a secondary disinfection system. Sometimes we call it a secondary treatment system. So we tried to wrap up a lot of those and clean it up from a consistency standpoint. And we also had a new chapter added at the end. You guys know that the previous MACs have had 6 chapters. Now we have a chapter 7, and this will allow us moving forward in future editions of the MAC to add special venues. For example, the section on float tanks is now in chapter 7. When we have other novel venues that come along that need some guidance, it'll go into Chapter 7 for special venues. So for the next MAC update, for example, I'm going to be submitting a change request in regards to artificial lagoons. It'll go in Chapter 7, which will be a lot easier to incorporate there at the end than trying to shuffle it into all the various sections throughout Chapter 4 and 5. All right, next slide. So I did want to highlight a few of the heavy hitters on some of the major changes, or what I would consider to be major changes. And this was a consistency terminology thing. So we did change it and we did get consistent, and we call it secondary treatment. It's no longer secondary disinfection system. It's no longer secondary treatment system. We tried to call it the same thing throughout the MAC and have it be defined as such. It also, in Chapter 47332, it covers login activation and installation. So it no longer limits the types of equipment that could be used to meet the specific treatment requirement, which allow more and possibly lower cost options for meeting the same goal. And for splash pads, it also sticks to its name in that it requires a secondary treatment, whether it's UV or ozone, to be located after the feature pump to treat 100% of the water prior to reaching the bathers. Now, this allows for more removal and not just inactivation of pathogens, specifically cryptosporidium. The next slide. Cyanuric acid is always one where we have a few change requests. There sometimes is really good data to justify a change. Sometimes there's incomplete data or not enough. So we're always really careful when it comes to cyanuric acid and any changes that we make in regards to recommendations for its use has had special consideration. So the MAC has always, well, not always, I think starting in, it's either the second or the third edition, but we had an operating value of 90 parts per million of CYA. And we've had an ideal operating value for chlorine of 2 parts per million. So that ratio, 90-2, is 45-1. So we wanted to make sure that that ratio is maintained. But there's a lot of wiggle room in the MAC when it comes to allowable amounts of chlorine. But we still didn't want the ratio to get fiddled with too much. So we kept it at 45-1. And that allows for a little bit higher levels of CYA if you have a little bit higher levels of chlorine. But the ratio is what we zeroed in on. And that is listed now as an intimate health hazard and requires immediate closure. So you'll find that in our inspection form. We had considered a upper max limit for the amount of CYA found in a pool. There was a proposal for, I think, 300 parts per million. There just wasn't the right justification and the adequate data to go with that. So that one was actually rejected. Next slide. Starting platforms. This was a change that had a change within the change. In the MAC previously, it had 4 feet for the water depth from on the wall right below the starting platform for competitive swimming. So these are the platforms that are not normally used in public pools. They're usually closed or not accessible, but these are used by competitive swimmers, particularly in high school and collegiate events. There was a CR change request that was proposed to change that depth to 5 feet. So we thought about that and we really liked 5 feet, increasing the depth. And we're thinking about preventing injuries on the bottom of the floor of the pool. But we also wanted to look at what does the existing data say about what should it be? Should it be 5 feet or even greater? So based on injury hazard data and the support behind that, we actually changed that request from 5 feet all the way to 6 feet. And that was approved by the Technical Review Committee, the CMAQ Board of Directors, as well as the CMAQ membership on voting. But we knew that this was a pretty drastic change. And one of the parts of that proposal was it was going to be for all new construction and for all substantial alterations. And that would pose a significant financial burden when it came to substantial alterations. So we revised the language so it only applies for new construction. This will keep the existing facilities from undergoing expensive modifications. And I apologize, I should have put another slide in here. I don't have it, so I'm just going to tell you. We adjusted the pH operating range. It had previously been 7.2 to 7.8 as our ideal operating range. We got a CR to lower that bottom part of the range to 7.0. So now we have an ideal operating range of 7.0 to 7.8. And I think it's important to know that those are not the closure limits. These are not that's not the range that beyond that is an imminent health hazard. It's the imminent health hazard, things that require an immediate closure remained the same from the 3rd edition to the 4th edition. So a closure is only warranted if the pH drops below 6.5 or is above greater than 8.0. So that operating range is still well within that wider, broader closure range. And that's reflected in the inspection form, the MAC inspection form, as well as the instructions. All right, next slide. All right, we're going to move on to Healthy and Safe Swimming Week. My colleague, Michelle Lasfa, she is in charge of Healthy and Safe Swimming over in the National Center for Emerging Zoonotic and Infectious Diseases, NCEZID. And every week, the week prior to Memorial Day weekend, which is traditionally across the country, a big opening weekend for pools. Every week prior to Memorial Day, they promote a new topic, a new theme for healthy and safe swimming. And this year's theme has got diarrhea, don't swim. And I can't think of a better theme to have for Healthy and Safe Swimming Week. I think maybe this should be our theme every single year. We preach it over and over and over about making sure that fecal material doesn't get in the pool. We know that's an impossible task. That's why we have filtration and disinfection. But one of the big points here is if you have diarrhea, which is abnormal, that's an indicator that you're sick. And if you're sick, to not go in the pool. All right, next slide. There are a lot of resources on CDC's website, and I'm going to show you how to get there on the next slide. But there are posters and graphics, and this is just a few example here. I pulled one here, facts about crypto and safe swimming pools, that talks about some of the risk involved with cryptosporidium and some of the things that are necessary to prevent that transmission in our pools. I handpicked a few of the graphics and a few of the messages, and this is a good one here on the right. If you wouldn't do this, swim in a toilet, then don't do that. Put your poop in the pool. Particularly if you're sick and you're having a little trouble controlling your bottom, it probably won't be a good idea to get into the pool and put other bathers at risk. All right, next slide. One of the big tools that are available on the Healthy and Safe Swimming Week webpage is the Communications Toolkit. And this is specifically for public health professionals to promote healthy and safe swimming messages on social media, websites, and other communication channels during Healthy and Safe Swimming Week, but also throughout the year. It'll provide guidance and examples on how to reach out to partners, how to post to social media, how to have a press release, particularly if there's an incident or an outbreak, but also graphics, posters, infographics, and those are my favorite tools, are the graphics and the posters. But how to get to Healthy and Safe Swimming Suite or Swimming Week on our website, just go to our main page, cdc.gov. You can type in the search for healthy water, and then you'll want to click on healthy swimming on the menu on the left. And then you'll see also on the menu on the left, another tab for Healthy and Safe Swimming Week. And you'll see all of the resources and tools, including this communication toolkit there on that website. Next slide. This is one of my all-time favorite graphics. Don't leave your mark at the pool this summer. It's an animated GIF, and this poor girl is contaminating the pool as she goes down the slide. And it only takes one person with diarrhea to contaminate the entire pool. And she keeps doing it over and over and over, and that's not a good situation. Next slide. Keep kids healthy in the water. We have another picture here of a diaper-aged child that may be sick and is contaminating the pool there. So we have some tips for parents and caregivers. Next slide. And this is another one where a kid, the guy there in the middle in the background, he wants to pee in the pool. And as we know, urine, when mixed with pool chemicals, can create other byproducts that could have a negative health impact on us. So pee mixed with chlorine creates chemicals that are called chloramines that can make your eyes red and itchy. And if you're in an indoor pool and the concentrations of chloramines are high enough, it can even cause some respiratory irritation. But if you look at that slide, after he pees, you could see our swimmer and the girl on the right, their eyes get red because that's what kids do. They open their eyes underwater. All right, next slide. So we had some historical tools that were available and associated with the Model Aquatic Health Code. And one was our Aquatic Facility Inspection Report. It's a long name, so we shortened it to something that's a little easier to say. So now it's called the inspection form. What I wanted to share with you today is that it's already been updated to match the 4th edition changes. And the changes to the pool inspection form are related to two things. One is, as I mentioned, the closure item of our CYA to chlorine ratio. And this is a new item. But also on the form, of course, you're going to check your water chemistry. As part of that, you're going to check your pH. We have the, I think the item is that the pH is in the proper operating range. So if you go to the cheat sheet, you go to the instructions for the form. Go ahead and give me the next slide. So our cheat sheet provides these instructions. Within the instructions on that item for pH is where we get a little more detail about that operating range that's now 7.0 to 7.8. But in that same bullet, we talk about what the closure is. So we want to try to make the tool, the inspection form, as easy as possible with as few items on it as possible. So it's not too overburdensome. So there's just one item for pH, but then using the cheat sheet and the instructions and understanding what the operating range and the closure range is helpful. There's one more tool that goes along with the inspection form. It's the cross-reference guide. And as you're using the inspection form, particularly when you're educating operators, you're talking about the violations, you're sharing with them all the things they're doing well. And they want to say, well, where does it say that? Where does it tell me I have to do that? Well, the cross-reference guide will help answer that question. So it goes through every single item in the inspection form, and it tells you all the places that you can find information about that particular item within the MAC. And it's usually going to be within 2 places, in Chapter 4 for design and construction, but also in Chapter 5 for operation and maintenance. And the cross-reference guide was developed for use in the field while conducting aquatic venue inspections and for report development. The reference guide links the NACCHO Aquatic inspection form to content in the code language as well as in the annex. And it allows an inspector to quickly locate code language requirements and the supporting information in the annex. And some of this information is particularly helpful when you're describing the violations that you find on your inspection report. Next slide. NEHA worked with me many years ago, and we developed together a pool inspection training online course that is available for everybody. And it's basically a step-by-step that is MAC-based on how to conduct an inspection of a pool. Of course, it's all online, so there's pictures, there's descriptions. It's not going to be as hands-on as something that you can get in another in-person course or something in the field. But this is kind of a just-in-time type of training. When I say just-in-time, you better have a lot of time because there's like 8 modules, maybe even 10 or 12 modules. And each one takes about an hour to complete. So it's very comprehensive, and it's based off of our inspection form that we have. And it goes through every single items and where you need to look for that item at the pool, in the equipment room, and some of the features of the pool, whether it's the water or the pumps or the filters or the drains. And as I mentioned, this is a free online course. It is available in the NEHA bookstore. So in order to get it, you need to have a My NEHA account. So when you go to the NEHA website, you'll need to create an account, and then you need to purchase the course. But the cost of the course is $0. So even though you have to select the purchase and go to checkout, the checkout is going to be $0. But within the bookstore, if you just do a search for pool inspection, it's like the second or third item down, and you'll see this logo here for the online training module. And then after you check out, you'll have access and the link to get to their learning platform. It's important to note also that for registered sanitarians, registered environmental health specialists that have that credential through NEHA, this training can help you earn 8 continuing education units that go towards our annual requirements. All right, next slide. That's it for me. There is our disclosure statement there at the bottom that somebody higher up the chain than me likes me to say, and that the findings and conclusions in this report, this presentation, are those of the author, those of me, and not necessarily represent the official position of the CDC. And with that, I'm going to hand it over to my colleague, Technical Director at the Council for the Model Aquatic Health Code, Dewey Case.
Thank you, Joe. Thank you for that introduction and for your presentation. Next slide, please. So as Joe mentioned earlier, the review process for the 4th edition, we were slammed with the immense amount of CRs. And it really kind of made CMAQ go back and rethink the submission and review process, and how can we streamline it? And most importantly, how can we kind of rework the system, so to speak, for our volunteers? So we spent a lot of time over the last couple of years really thinking and digging into that process. And so we came up with some revisions that we're making to the review cycle. Next slide, please. So again, you know, we go back and we've been saying this a couple of times now, but really 500 plus CRs was an insane amount of CRs to handle. And to top it off, we had a little thing called the global pandemic we had to deal with at the exact same time, where individuals are furloughed, but most importantly, our public health officials were not able to carve out time. This was the early days of the pandemic, and certainly the review process was delayed because of that. And kind of a third thing too is, not only with these number of CRs, were they just a massive amount, but also we had some that were not the highest quality CR. So we've kind of looked at a threefold mechanism, threefold approach on revising this process. Next slide, please. So we looked at 4 different areas. One is limiting CR entries per submitter. The other is having only substantial changes, not allowing editorial CRs, also not allowing annex CRs, and overall improvements to the review process. We'll talk about each of these specifically in the next few slides. Next slide, please. So the biggest thing was limiting the CR submissions to 50 per person. There's been a little confusion of that where we thought we're only limiting to 50 CRs. No, 50 CRs per person. To give some historical perspective, for the 4th edition MAC, there were 2 individuals that submitted over 200 change requests of varying degrees. Some were really good, some were rejected, and some needed substantial improvements, and some even contradicted themselves. So that was definitely a slog to go through. So when we looked at the concept of do we limit submissions, we had to look at historical data. And historically, if you go back for the 2nd, 3rd, and 4th editions, and you throw out the outliers, what we see is the average submitter submitted around 5 CRs. So we knew 5 CRs was way too little. That would be very, very limiting. So we just multiplied that times 10 and went up to 50 CRs. So this is 10 times the number of average CRs that have been submitted, again, throwing away those 2 outliers. And we feel that that is an adequate number of CRs, more than adequate, to where we're not limiting the change request process, to where we're not making a submitter choose between 2 really good CRs that may need to happen, without having this open, well, I won't say open, but free-for-all submission where someone can just throw in change request after change request after change request. So the hope is with the 50 CR submission, we'll actually see higher quality CRs and more meaningful CRs than we have in the past. This also makes our review process much simpler for all involved, from our CR facilitators and all involved in our technical review process, including staff, as well as CDC. Next slide, please. So when we looked at editorial CRs, we had a lot of discussion over what the concept of editorial CRs are. We feel that editorial, and CDC agrees, is in the purview of CDC itself. Now, to do this, we had to look and see what is an editorial CR. Joe had a really good example earlier of secondary treatment, changing secondary disinfection to secondary treatment. That's a CR that's editorial in nature. It doesn't make any significant changes to the meaning of the code, and it's something that's relatively easy to do. So when we looked at defining what an editorial CR is, it's really grammar and editing. It's things where there's a small caps indicating a definition where there is no definition. It's things of that nature. And again, editorial CRs would only be those that have no meaningful change to the code and no meaningful impact. So we had to define that concept of meaningful change, and we chose to define that as a change that alters the intent or meaning or provides further technical clarification on any given code section. So the question now is, who is determining what is an editorial CR? To answer that question, we have developed an editorial review board. So there'll be 5 individuals. There'll be myself as technical director. There'll be the TRC chair, the TRC vice chair, a member of the CMAC board of directors, and a CDC representative. So any CRs that come in that are editorial in nature those will be reviewed by the editorial board, and if they're editorial in nature, they'll be submitted directly to CDC for consideration and will not go through the TRC review process. However, if this board determines that, yes, this is a substantial change or a meaningful change, then that will be entered into the TRC review process. In an effort of fairness, because the submitter won't know early on whether or not this is editorial or if this board determines it to be meaningful change, CRs that are submitted as editorial in nature, we're not going to count that against the 50-person submission. Next slide, please. Another decision was not allowing annex CRs. Much like any editorial changes, the annex solely rests in the purview of CDC. And we've accepted annex CRs in the past, but that's not really what the intent of the review process was in its spirit. The annex was always intended to be an explanation of the existing code. So we're removing annex information or annex submitted CRs. This does not mean that you can't recommend annex language. All this means is that this will not go through the TRC review process. Again, we'll have a mechanism similar to the editorial review board that will review that annex recommendation and make recommendations to CDC for inclusion in the MAC annex. We also, if the TRC run across information or a CR rather, where the TRC feels that this will be viable annex information, then that will be flagged and marked for the future. And again, changing the annex adds unnecessary complexity to the whole review process and can add significant confusion, right? So if you have a voter that is reviewing a CR, they may miss its flag for the annex. So we have several of those issues that would be alleviated by removing the annex from the review process. Next slide, please. As far as overall process improvements, one of the big changes is no more Word documents that have to be filled out, saved as, or scanned, and then emailed back. Everything is electronic submission. You can go to cmac.org/change_request.org, or really .org, we can leave that off, that's superfluous. But cmac.org/change_request, and you could submit a change request electronically. We have cleaned the form up to make it a little bit more user-friendly as we can. But the big thing is all electronic submission. I do have to say that it is still free. You don't have to be a member of CMAC to submit a change request or submit a comment, but you do have to register on the website. And that's just basic IT security information, right? But you do not have to be a member to submit a CR or make a comment. Any stakeholder, even if you're just a lap swimmer or a swim mom for a swim team, can submit a change request. You do, however, have to be a member of CMAC to actually vote. In addition to the change request submission process, we've also created online forms for our technical review committee and our technical support committee, to where, again, we're trying to streamline the process. We're trying to make it easier for everyone to volunteer their time and do the work associated with the review process. And then we've already talked about the creation of the editorial review board. We haven't talked about the Annex Revision Committee because that is actually a standing existing committee with CMAC. We'll be launching that committee and bringing them, or standing up that committee rather, in the next month or two. Next slide, please. Other things we've done for the review process is we've done some further refinement for the roles of the TRC chair and vice chair, including approval, right? So in the past, these were just kind of selected, right? And we've had really, really good luck getting some just outstanding chairs and vice chairs. I have to say that we've been really, really good about having some really high caliber folks. But in the interest of making sure we're transparent, right? And making sure that everything is having multiple layers of review, We are now requiring that this TRC chair and vice chair be reviewed and approved by the CMAQ Board of Directors. Just adding additional safety mechanisms to ensure that we have the highest caliber folks and that everything is on the up and up, so to speak. We're also automatically assigning CRs to our technical support committees. In the past, the CR facilitator would have to have had to review the CR and then decide whether or not it goes to the TSC or not. From this point forward, we'll automatically assign the TSCs the change request to review. The facilitator will still have to interact with TSCs, but it's really gathering data and answering questions and not so much assigning these for review. One of the big changes is we've changed terminology from CR champion to CR facilitator. This actually was a recommendation that came out of one of our ad hoc committees, and it makes wonderful sense. When you hear champion, what you hear is someone that is supporting, they're advocating for, they're encouraging the approval of that change request. And that's not what the CR facilitator role is. Going to facilitator, all this simply means is that this individual, this TRC member, will review this assigned CR, gather background information, look at the TSC reports, and then present that in a fair and equal manner to the entire TRC. So they're just leading the discussion. They're taking a neutral stance, so to speak, unless, you know, they would make a recommendation on a vote, you know, so I do have to clarify that. But by and large, this is going to be a neutral approach, right? They're not going to champion or try to support this because they have an affinity for the CR or any sort of other vested interest. It is purely a discussion-led change. And our TRC and TSCs, we're going to start forming those as soon as the change requests are open for submission. We actually have formed all of these committees, and they're being stood up as we speak. The first TRC meeting will be coming out in the next couple of weeks. So please pay attention to cmac.org, our CMAQ Connect, our social media page through Facebook and other sources to where you have that link to be able to dial in and call in and listen to discussion. And the last kind of process change is we're going to start working on CRs as they come in. We're building in mechanisms where we can go back and catch comments, where we can go back and catch additional information that's been submitted since that CR has been reviewed. But we're not waiting until the whole change request window closes and then having marathon sessions. I was fortunate enough to participate on the 3rd edition TRC, and that's kind of what happened. The submission window was June to January. The TRC was stood up around April, May, and we worked over the summer, which was not ideal. We had some very long marathon sessions. Similar thing happened with the 4th edition, where the submission window was June to January. We stood up the committees in April. We immediately got shut down for the pandemic. And then late May, early June, started work and had to complete it by August to meet our 60-day second public comment window. And that was very, very tight and very difficult for all involved. So by elongating the review process to coincide with CR submissions, then we're actually putting less stress and wear and tear, so to speak, on our volunteers. So the submission window is open. It opened on April 15th, and it will be open until October 13th. The TRC and TSCs, their chart of work actually extends into November 13th, 30 full days after the close of the change request window. This was very purposeful to where we had adequate time to address any submissions that came in at the very last minute. So we're not having to rush through it. We're not having to preemptively close off the CRs. It also gives us time to go back as a TRC to look at any comments that have come in by October 13th and then reevaluate whether or not a vote needs to be changed. Next slide, please. With that being said, turn it back over to Daisy and we can open up for questions.
Thank you so much, Dewey, and thank you, Joe, for the wonderful presentations. So just to remind everyone, if you have any questions, please use our Q&A box, and you can submit any questions to our speakers. To start off, we're gonna read over some of the questions that were submitted. They were answered here for those who are online. You can see the written response, but we're gonna ask them verbally as well. So for those that are just listening to the call, they have access to it too. So Joe, I believe the first question is for you. When there is an imminent health hazard based on the CYA ratio, if it's above or below, what is the variation, the ratio that you're looking at?
Yeah, that's a good question. It's really going to be based on the direct measurements of each of those parameters. So it's the amount of CYA compared to the amount of the chlorine, and the ratio of that. We're looking to make sure it doesn't exceed 45-1. So we're worried about the amount of CYA being too high compared to the amount of chlorine. We had a lot of discussions about this ratio. We had some CRs submitted that were requesting much lower ratios and much higher ratios. And there wasn't really a lot of data to support, a shift in this ratio in either direction. So we went based on what was already in the MAC of what's our ideal operating levels for chlorine and CYA. And I think it's important to note that the operating level, the upper operating level for CYA is 90 parts per million. But that is not a closure item. That is not one of the things that we have listed as an imminent health hazard, that if you exceed 90 parts per million, you got to shut it down. It's not presented that way in the MAC at all. But CYA is one of these chemicals that doesn't break down all too well in pool water. So as you add CYA to help stabilize your chlorine, the chlorine is going to get gobbled up, the chlorine is going to burn off, but the CYA is going to stay there. And as you add more and more and more, those CYA numbers are going to get up. So it's kind of there to make sure that doesn't get out of hand. And unfortunately, there's not a lot of easy ways to bring down your levels of CYA. But I think the question there is, what's the variation on the ratio? So I pulled out a calculator and just did a couple calculations. So if your chlorine is a 1 part per million, a 45-1 ratio of CYA would be 45 parts per million of CYA. If it's 2 parts per million chlorine with that ratio, it's 90 for cyanuric acid. If you have 3 parts per million chlorine in your water, you wouldn't want any higher than 135 parts per million of CYA. And for 4 parts per million chlorine, you wouldn't want your CYA to exceed 180 parts per million to stay within that ratio.
Thank you, Joe. So we have another question for you to answer live, and it is, would the NACCHO inspection training be the equivalent of a CPO?
No, it would not. This is more of a continuing education feature. It's more of a just-in-time feature. It does not have the associated credential that goes along with it. So it does not equate to a CPO certification. That requires a different course and a different exam that must be passed. So it's just simply additional training for pool inspectors, health officials, heck, even pool operators, so they know what to expect when the inspectors come around.
Hey, Joe. Now, the next question, one of our attendees is asking, who can they reach out for questions regarding specific code sessions in the 4th edition of the MAC? There are some sessions which are not clear, and the annex doesn't provide additional information. Would that be, oh, go ahead, Dewey.
Yeah, no, I was about to say, Any questions on either the code or the annex, you can reach out to me directly. My email address is Dewey, DEWEY, CASE @cmac.org. I love fielding questions. I love helping folks and providing clarification. So certainly feel free to do that.
Yeah, and feel free to reach out to me anytime as well. I had my contact information listed in my slide deck. You could always reach out to me directly, either through email or my work phone. We'd be happy to talk shop with you.
And if you want your head to explode, loop us both in.
Oh yeah, that'll be more fun.
Right, so our next question is, closure ranges for free chlorine are beyond the range of the test kit indicator. Is there a broader range kit available?
Actually, yes. So what you would look for is what's referred to as an FAS DPD. Now, don't ask me to explain what all of that is, but your typical DPD indicator, it does max out at around 5 part per million. You can do a dilution test to get that same number with the popular brand in the blue box, I know. And certainly with the other brands as well. But look for an FAS DPD. It does not bleach out, and then you can read in increments as low as 0.2. I have personally tested with an FAS DPD up above 40 part per million with no bleaching.
Yeah, and I would also refer to the manufacturer instructions on how to properly use one of those test kits, particularly if you want to do some dilutions. Make sure that that is an acceptable method for the particular kit, the particular instruments you're using.
Yep, absolutely. And another option too is photometric or electronic testing. That can be, depending on the manufacturer, a little bit more limiting and certainly more expensive. But you also get very accurate if you have that in your budget range.
So our next question is, with the new Chapter 7 coming out, will that include items that are new to the water rec industry, like cold plunge tubs, recirculating spray pads, dealing with main drains that are not submerged, etc.? Will this chapter help detail how to plan review on them?
Yeah, that's exactly what Chapter 7 is going to be used for. I'm not sure if I mentioned it, but I'll be submitting a change request for operations of artificial swimming lagoons. And these are kind of a new concept here in North America. And they're a big question mark for a lot of health officials. So we're going to put that in Chapter 7 based on the guidance that was come up with the CMAC ad hoc committee. When it comes to spray pads, interactive water play venues, splash pads, there's quite a bit in the MAC already about that, particularly your question about the main drains that are not submerged. Maybe we could have an offline conversation about that. And Dewey, I think the last part of that question was, are we going to ever provide guidance on how to do a plan review?
Yes, we will. CMAC is looking at creating a couple of courses to help our health officials. And one of those is a plan review course. We hope to have that pilot done in the next 2 years or so for that one.
Yeah, I'm not sure if that'll be in the MAC, but it's definitely a gap that CMAC's looking at to fill the need to better understand plans when you're reviewing them.
I will say this because it's mentioned. I know cold plunge tubs are booming in popularity right now. These have not been addressed by the MAC. So that's something where a well thought out, very well crafted series of change requests could be useful, or we would have to stand up an ad hoc committee. If we stand up a committee to review those, I'm not quite sure we can get a good review and recommendations done before the October 13th deadline.
Right, and that I was going to say that's also another questions up there about hot springs. Hot springs has been a topic that has come up quite a bit in the last couple of years. For those of you that are familiar with hot springs, they have a lot of mineral content that some feel have therapeutic value. There's some salt content that's naturally occurring, and when you start adding chemical disinfection, you start incorporating filtration, it changes the chemistry of the water, and it changes the reason why people want to go and soak in this water. However, yes, there are risks involved with these. So we actually are in the process of getting a hot springs ad hoc committee together with CMAC, and I'll be on that as well. But that one's so complicated and so complex and so as a specific niche, it's going to warrant quite a bit of discussion, and it's going to warrant expertise from the scientific community, but also from the hot springs community. I don't understand a lot about how these work, but there are some obvious risk associated. And like Dewey said, when we start pulling in the experts to have these thoughtful discussions, it does take a little bit of time, and we probably won't be able to have any guidance ready for the 5th edition of the MAC because of this October 13th deadline.
All right. So our next question is, will the healthy swimming posters be available in other languages? If so, what languages? If a particular language is not available, can the local jurisdiction make their own translations, or are there copyright issues of that? Could they remove the CDC logo if creating their own translations?
Yes, they are. I'm trying to go to it right now. Trying to find those posters. I do know that they are available in other languages. Let's see, Healthy and Safe Swimming Week. All right, it's not on the Healthy and Safe Swimming. Those are available for download for free. Yes, they can be used by other jurisdictions how they see fit. I don't believe that there are copyright issues with that. I'll look into that, and if that is the case, then I'll let Daisy know she can communicate it out to this group. But I have seen that these messages are available publications. I'm not looking in the right spot.
Be happy to share the link to those in our follow-up email as well.
Yeah, that might be what we need to do.
Yeah, we can definitely do that. Yeah. Okay, well, it's exactly 2 p.m. here in the East Coast. So with that, we want to be, thank everyone for your time, and really want to thank our speakers, Joe and Dewey. Thank you so much. And thank you for sharing your great knowledge with all of us. It's always so great to hear. And we really look forward to our next webinar. Again, a reminder to everyone, we'll follow up in an email with the slides, with a copy of the recording, and also with some of the materials that we mentioned, including those communication materials from CDC. But thanks,
Daisy,
everyone.
I did find where those posters are, and I just put it in the chat for us. If you're able to put that into the webinar chat for everyone to view, they'll be able to see that. It's basically under healthy water and safe swimming, under the materials and communication materials. And not all of them are available in different languages, but some of them are available in Spanish.
Thank you, Joe. I just share here with everyone, and we'll also make sure to include it in our follow-up email to everyone as well. With that, really thanks everybody again for your time. Thanks, Joe and Dewey, and we'll see you in our next webinar. Have a good rest of your week, everyone.